And then race day, you're going to have to be there bright and early to check on your things race morning in the transition, and then walk a full mile up to swim start. Make sure you bring comfy shoes to walk that mile up to the start. You can always put your race morning clothes into a clear plastic bag, which we issue to you in your race packet that you'll get at registration. And you can just drop that in a clothing truck at the swim start, and we'll have it waiting for you when you finish the race in Central Park. You'll be swimming in the Hudson River. For those of you new to swimming in the Hudson, it's clean. We test it. It's actually a very clean body of water, but what often takes people by surprise is the fact that it's salt water, and there's a pretty strong current. Depending on when you go in the water, the current may vary, but be prepared for a current swim. It could be pretty quick for many of you, but having said that, we still require this year that you do a half-mile open water swim so that we feel confident, you feel confident that you're comfortable in open water. The bike course is on the West Side Highway. It's a rolling course. I think you may be a little bit surprised to see that New York City isn't entirely flat. There are some inclines and a few technical turns on the course, but for the most part, it's a straight out and back route. The run route exits out of the transition on a pretty steep but short incline, and then goes across a flat 72nd Street running through the city of Manhattan. It's Upper West Side through the nice tall buildings. It's a beautiful run, lots of spectators out there to cheer, and then you'll end up doing a 5-mile loop around Central Park before you come to the finish line. So that's just a broad overview of the race. I'm going to turn it over to Doctors Joe and Mark to give you a little bit more information in detail, and then we'll also open it up to questions.
Excellent. Thanks a lot, Vic. Well, hopefully everybody can hear me. What we'd like to do is go through about a 10 or 15-minute just presentation, which we did a few weeks ago for a group similar to yourselves, of just what about injuries are and what you can do now in the next few weeks to try and make sure that race day is a perfect day for you. And then we'd like to entertain some questions, which you can do on your screen. There's a little chat box, and if you start typing a question in there, both Allie and Vic will potentially be able to see that, and they'll relay those questions to us, and then we can go through and answer. Now, obviously, you know, it's hard to answer some of the questions without examining an individual, without really getting a full history, but we'll try and do our best in terms of conceptualizing what it is and what we think you can do for this to try and help you get along. In respect of everybody else's time, if there are repeat questions, we'll try and answer those, but also we're going to try and stop this at 8:30. We could answer thousands of questions, I'm sure, and I'm sure there will be lots of questions, but again, in respect of everybody else's time, we're going to stop this around 8:25 or so. So just to go through some of this, I'm going to talk a little bit about injury and injury prevention. And again, most of what I say here, although I've listed this as running injuries, you know, this pertains to any type of overuse situation that you might run into with endurance activities. Obviously, when you talk about injuries, you can talk about the mechanism of injury. You can break it down into trauma as well as overuse. Trauma is simply, you know, a significant force to normal tissues that cause failure and injury. You know, you fall off your bike, you break your arm. I mean, it's pretty self-explanatory. But these overuse injuries are a more difficult entity, and it's something that plagues most endurance athletes. This is a situation in which there's failure of tissue to less than maximal force. Think about your bodily tissues as a coat hanger or even a paper clip. If you were to take that and bend it, certainly not inducing a great amount of stress, it eventually breaks. So it's these repetitive microscopic injuries that seem to break our tissues down, and they often take a little while to do. So there's never one single event that someone remembers and goes, ouch, that hurt. It's often, gee, I woke up, you know, after my workout maybe 2 days ago, and God, you know, my ankle's hurting me. And that's kind of a classic history of someone who sustains an overuse injury. Again, in any type of an injury, there's obviously biology of healing. You know, our bodies are great at getting us to heal and to feel better. And if you break it down, there's always this initial response to tissue failure, and that's bleeding. And bleeding, to a certain extent, is actually very good. It does cause some swelling and subsequent bruising, but that's kind of our natural body's response to an injury. What then happens is that there's cells that are recruited, specific healing cells, that often, go to the area. We get a little bit more continued swelling, and then ultimately tissue organizes and proliferates. The swelling plateaus and pain subsides. This is really the beginning of tissue maturation and getting better, and going on to normal tissue healing. That's when we often see people getting better, feeling better, but you have to understand that when you have that initial bleeding response to injury, whether it's trauma or it's overuse, things take time. This is where modern science doesn't have the answer, the end-all. It takes anywhere from 4 to 6 weeks and sometimes longer to get over these injuries. So again, counseling an individual is that you have to be patient with something like this. The problem arises when people have chronic injuries. So the pathophysiology, what goes wrong with the tissue? Well, again, I said, you have this initial response to tissue failure, you get some bleeding, it causes swelling, there's cellular recruitment, but then you get the overuse athlete, the endurance athlete, who says, you know what, my ankle hurts a little bit, my knee hurts a little bit, I'm going to continue to do what I'm doing, and I'm going to try and push through this. What happens then is that tissue maturation phase suddenly becomes disrupted. You get altered tissue organization, you get persistent swelling and pain, and this tissue maturation leads to scarring. And when scarring occurs, that's when we see patients and they get clinical problems and functional impairment, meaning they can't run, they can't bike, they can't swim because they've pushed through their injury. So we often say, why is it me? Why does it happen to me? Well, I don't mean to offend anybody, but it's, injuries are not an act of God. It indicates that an athlete's really reached a breakdown point. We are like machines. Everything seems to break down at some point or another. Muscles, tendons, ligaments, and all other tissues are essentially made of collagen. Collagen are proteins. Think of it like a rope. You pull on it really hard. Eventually, some of those fibers are going to break. Obviously, there is that cellular healing response. You get bleeding. You get a hematoma, which is a clot formation. You get healing tissues. But again, if you have this repeated injury where scar tissue formation, which occurs over a gradual period of time, you get that dreaded overuse injuries. But understand that all of these are curable if they're caught early. And that's the take-home message, is that if you start to feel something, you need to do something about it. So what are the steps to recovery? Well, obviously recognize that there's a problem. That's, human nature is to say, well, I'm just going to keep pushing. There's nothing wrong. It's a little ache or the pain. You got to recognize it. Once you recognize it, you need to take positive actions. You treat the cause, not just the effect. So if there's swelling, yes, you put some ice on it, but you have to think back and say, well, why did this happen? What do I need to do in my training, in my equipment, to make this not happen again? And then obviously, don't be a martyr. The concept of no pain, no gain is just not acceptable for something like this. You cannot push through a lot of these injuries. You have to treat thyself. You have to take care of yourself. You do a great job at doing all the training that you're doing, following schedules, avoiding all requirements of life and what have you just to train. Treat yourself. If there's an injury, take care of it before it gets the best of you. So with injury recognition, we are all bad patients. Me as a physician, Joe as an athlete and as a physician, we've gone through the gamut of injuries. We've all said, it's not so bad, I'll push through. And we've all suffered because of that. So you have to be careful of that. The big thing sometimes with these overuse injuries is that there's no obvious signs. Sometimes you don't see swelling. Sometimes you don't see bruising. So pain is really that one thing that has to alert you that something is wrong. Now, good pain versus bad pain. Hard concept to understand, hard concept to sometimes, instruct people on, but I would often say that if you have some discomfort that seems to warm up after you do an appropriate warm-up and get into your activity and it kind of goes away, that's probably okay, but still needs some attention. The bad pain is every step that I take, every revolution on my bike, every stroke that I take, I'm having a repetitive type of discomfort. That's a bad pain, and that really needs to be taken care of. Experience and maturity are our best friends. They truly are. Sometimes you have to back off from those workouts and say to your friends, sorry, I can't go today because I'm just not feeling right. There's nothing wrong with that. Better get better first and then be able to race strong later on. So when you treat the cause and not the effect, well, the acronym of RICE, which is Rest, Ice, Compression, and Elevation, that's fine for some people, but to tell a triathlete, gee, you know what, you can't do that, no one wants to hear that. So we like to use the relative rest, ice, compression, and elevation. Relative rest means if there's an activity that you can do that doesn't seem to bother you, then that's the realistic thing that you should be doing. Equipment issues, again, we can go through, shoe wear, from, minimalistic shoes to a well-supportive shoe, but a tip that I like to do is I date all the sneakers that I wear so that I know exactly when that sneaker is going to wear out. Again, rough estimates are anywhere from 300 to 500 miles, 4 months, somewhere around there is about an appropriate time to change a sneaker. Dietary considerations. We all like to do triathlons because for some people it allows us to eat a lot. But you have to be careful with that because, you do want to basically replenish the calories that you've burned. If you go into a negative caloric balance, meaning that, I'm not going to eat, I want to lose a lot of weight, you will adversely affect performance, but you will also adversely affect your bodily mechanisms, the things that are helping you to stay healthy. So you have to be careful about dramatically losing weight. We often see that in young women who have bad dietary habits and sometimes will develop stress fractures because they've lost an awful lot of weight and it's upset their hormonal imbalance. Supplements, I'm not a huge fan of supplements, but I think a multivitamin is an appropriate thing to do. I think if you do eat a healthy diet, you probably don't need any of the extra things that are in there. And sometimes you actually have to be very careful because in high concentrations, especially if you are in a dehydrated state of endurance training, the concentrations of the vitamins that you actually ingest will be magnified because you don't have the same fluid volume, the amount of water that's inside of your body, diluting that. So that's important. Recovery is also very important, both physical, we need rest days that are in there, mental recovery. Sometimes you just feel burned. Classic overuse training syndrome is someone who is irritable, someone who loses sleep, and they don't do well because they're not recovering well enough in their workouts. A good, strong program that's that's done for you by a coach is very helpful in trying to work those days in. And obviously, we have seen lots of people who have altered immune functions, especially after long endurance events. So there's a very high propensity of individuals after a marathon to develop an upper respiratory infection. In these individuals, it's because they've beaten down their immune function, and their bodies have gotten the best of them, and they develop these symptoms, and it can be problematic. So you have to be very careful with that, and I think recovery is very good. With recovery is sleep. We as triathletes tend to burn candles at both ends, and that gets us into a little bit of a problem. And one of the quick take-home messages that I like to do, and I've told a lot of my patients, is that I wake up every morning. My wife thinks I'm a little crazy, but I take my resting heart rate. Before I actually get up out of bed, I measure my heart rate. I'd like to see that it stays very much the same from day to day. There are some slight variations of a few beats, but you will find that if there is a variation of greater than 10 beats or so on a given day, it often heralds the fact that you're about to get sick and that you need some recovery days in there. So I think it's a nice take-home message of something that you can do to be proactive about some early warning signs of potential immune dysfunction or overtraining. To take the positive actions, if it hurts, don't do it. We always find some way to make it not hurt. We modify activities. If it's not running, well, then it's water running. If it's not running, maybe it's the elliptical. If it's the bike, maybe we go do the rower. There are lots of things that you can do to modify the activity. We always like a logbook because in that logbook you can mark down, what you've done, and we can look back because it's very easy to forget. Gee, did I ride 30 miles or did I ride 50 miles? Some people are more compulsive than others, but it's a good way to look back and to figure out where you might have made the mistake. And I think the most important thing is really to ask for advice because in essence, you are not alone in this process. I like to say that around the New York City Marathon time, we see hordes of individuals that come in with anterior knee pain, with the classic runner's knee. And everybody's panicked. But, the minute they come in and we're giving them some reinforcement that there's nothing structurally wrong, people can work through this. But you need to reach out and you need to find someone that's going to understand exactly what you like to do so that they don't give you the answer, well, if it hurts, don't do it. So I think on that, we talked about no pain, no gain. We talked about treating thyself in terms of activity modification.